standard treatment is the CPAP machine. Unfortunately, a lot of people can't tolerate the CPAP machine. So really, according to the American Medical Association and the groups that treat sleep apnea, you're looking at surgery or dental appliances. Unfortunately, neither of those have had great success results. And the reason is because both of those treatment modalities, neither one addresses the tongue. The reason why the CPAP machine is so successful is because it specifically addresses the tongue and keeps the tongue from falling back. Now, what I have done is invented an appliance that specifically addresses the tongue to keep it from falling back. You see, the average dental appliance is called what we term a mandibular advancement device. The mandible is the lower jaw, advance, bring it forward. So what we're doing is we're bringing the lower jaw forward and holding it there. Well, we can create some jaw problems as well. But the problem is, yes, it will open the airway if you're sitting up, but the minute you put your head back, boom, the tongue falls back. In fact, the easy test that anybody who has sleep apnea snoring can do, and they already know it, if they sleep on their back, the situation's always worse. If they're on their side or their stomach, it's never as bad. Well, if you look at the anatomy, the reason it's always worse on your back, or the only reason it would be worse on your back, is because the tongue is falling back. And we looked at that. So what I created was this appliance right here. I invented it 1.5 years ago. And what this appliance does, it's very comfortable, number one, because all the other appliances are in upper and lower. You can't open and close your mouth. You can't talk with them in it. With this, it goes on your lower teeth, right like that. And by being on your lower teeth, you can open and close your mouth and you can talk with it. Now this horseshoe right here is what my patents are on. And this horseshoe keeps the tongue from falling back. So, boom, you put it on. As you put your head back, this horseshoe keeps the tongue from falling back. And that's how it works. Our success rate is phenomenal. We're having on average 85% success rate for both reduction of snoring as well as sleep apnea. And we document this on each and every single patient with a post-sleep study. So I don't want just the patient to tell me, oh, I'm doing great. I'm not snoring anymore. I feel great. I feel refreshed when I wake up. I don't get headaches in the morning when I wake up. I'm feeling wonderful. I want those symptoms. I want that to happen. But on top of that, every single patient that I treat will have a mandatory sleep study at the end of treatment that is included in their fee. And that will prove that they are now safe. Because when you have sleep apnea and it's not treated, you're literally a walking time bomb. We know all the issues: strokes, increased risk of heart attack, increased risk of diabetes, and all the different things. Even Alzheimer's now, Stanford is looking at. So we know the problems. We know how serious this is. We know by not being treated, it's like you're a walking time bomb. But so many people won't and can't tolerate wearing a mask and a CPAP machine the rest of their life every single night. And when they travel, they have to carry this bag as carry-on luggage. Well, the people who have to do it, they know how difficult that is. Now, they can wear an appliance just like this that fits in their pocket. And it's that simple, and they'll get the same results that they get with that. We offer a free consultation. Anyone can come in and get this free consultation and find out much more in depth of what's going on. The more you know, the more you're going to like this.